Hi everyone, welcome back to TruthMed. I'm Dr. G, and today we are finally going to break free of the chains of COVID-19, at least for a little while, and talk about a totally different medical topic. And specifically, we're going to talk today about strep throat, a common enough condition, but there's lots to know, and if you know, it'll make your life a whole lot easier the next time you have a sore throat. Okay, welcome back. So, strep throat. Most people have had strep throat at one point or another during their lives, but it can be a pretty important condition to know about for a few reasons that we'll discuss today. And even better, if you have the power of medical scientific knowledge, then you can know whether it's something that you can just take care of at home and that you don't need to worry about all that much, or whether you actually do need to go see a doctor. So let's get started. Well, the main symptom of strep throat is, of course, a sore throat. But other symptoms that most people with strep throat are going to have include a relatively high fever. This is not your sort of 99.8 degree Fahrenheit sorts of things. People are generally going to have a temperature above 100 degrees, and often it will be above 102 degrees Fahrenheit. Pretty high fevers. Additionally, most people are going to have cervical lymphadenopathy. What that really means is your lymph nodes in your neck, right in here, right in these regions here, are going to be inflamed. So you get these tender, lumpy, bumpy things in your neck. Symptoms that aren't as common but still happen a fair bit of the time are nausea and vomiting, and then much more rarely people will get a rash. Now, if you do happen to get the rash, then you have unlocked the achievement of scarlet fever. Congratulations. Which basically means that you have strep throat and now you have a rash, but at least it has a cool name, right? Now, most causes of a sore throat are actually viruses, and some common viruses that cause a sore throat would be the things that cause coryza, which is actually the common cold. And that would be things like adenovirus or some types of coronavirus. Where have I heard that name before? But it can also be caused by things like influenza or Coxsackie virus or measles or chickenpox or the Epstein-Barr virus, which is what causes mononucleosis, which is also called mono, which is also called the kissing disease. Now, you should note that you can get mononucleosis from other things besides kissing, but they aren't anywhere near as fun, so why on earth would you choose to do that? You can also get a sore throat from things that aren't infectious or contagious at all, things like acid reflux or the inhalation of smoke or other irritants or drinking something that is caustic. But strep throat is caused by a bacteria called Streptococcus. Streptococcus makes sense. Streptococcus has lots of different species, but the main one that we care about here is called group A strep, or Streptococcus pyogenes is its official name. Quick tip. Pyogenes is Greek for creator of pus. Think about that in the back of your throat. Now, about 10% of sore throats are caused by strep throat. And like a lot of infectious diseases, it is typically spread by droplets and by contact methods, particularly things like kissing or sharing eating utensils or sharing a toothbrush, things like that. But to a lesser degree, it can be spread by, say, a sick person touching, let's say, a doorknob, and then you come along, you touch that same doorknob, and then you touch your face. It can be spread by that way too. It doesn't, however, spread very well at all through the air, thankfully, so that's good. It's worth noting that people who get strep throat are actually pretty sick people. This is not the common cold. This is not something that is, you're mildly miserable, but you can push through it. This one tends to knock people on their butts for a while, and the sore throat is a bad sore throat. It's not just scratchy and irritated. This one hurts. The incubation period for strep throat is about 1 to 5 days. And if you haven't seen my other videos, incubation period is the time between when you become infected with strep throat and when you develop symptoms. And for reference, 1 to 5 days is pretty fast. Now, again, most causes of a sore throat are viral, which means that you don't really need to know which virus causes it. It doesn't matter because they're all going to go away on their own, given a little bit of time. But specifically, if it's viral, you do not need antibiotics. They won't do you any good. All they will do is give you side effects of antibiotics and cost you money. But strep throat is a little different. In strep throat, antibiotics do help. Specifically, they will make the symptoms go away a little bit faster, and they will also reduce the time that you are contagious. And to give you an idea, if you have strep throat and you are not treated with antibiotics, you can be contagious for as long as 2 to 3 weeks. However, if you are treated with antibiotics, you are often not contagious after about 24 hours once you start the antibiotics. So it makes a pretty big difference. But another important reason to be treated with antibiotics for strep throat is because strep throat can kill you. Now, that does not happen very often. It's actually quite rare, very rare in fact, but it can happen. And even if it doesn't kill you, strep throat can actually cause you permanent damage that will last you the rest of your life. That also is quite rare, but it can happen. And if you're treated with antibiotics, it won't happen. So what are those rare complications that you can see with strep throat sometimes? Well, the most immediate one would be generalized sepsis, followed by death, if not promptly treated. Remember, sepsis is a word that we use to describe an infection that is normally localized to a particular area of your body, say your throat, but now has become more severe and is making you ill all over. Your blood pressure can become very low, your heart rate can become very fast, and you can start to have failure of one or more of your organ systems. It's pretty bad stuff. Now, again, it's very rare in strep throat, but it can happen. And when it does happen, it's referred to as toxic shock syndrome. Another rare complication that you can have with strep throat is you can form an abscess around the area of your tonsils, which is not only nasty and very painful, but it can sometimes be dangerous too. But even if that doesn't happen, even if you get strep throat and you don't get treated and you get better and nothing horrible happens, you can still be harmed by that infection later on down the road. And this is referred to as a late complication. And one of the late complications of strep throat is called post-streptococcal glomerulonephritis. Say that 3 times fast, I dare you. We call it PSGN for short. But all it really means is that antibodies that your body formed while you were fighting off that infection later cause damage to your own kidneys. And it can lead to kidney failure and even the need for dialysis. It is a complication that, again, is rare and happens late, and it is totally preventable if you're treated with antibiotics. But if you're not treated and it happens, it may be too late by that point. Another big problem that can be caused by strep throat is referred to as rheumatic fever. Rheumatic fever is a complication that involves the heart, and specifically the valves in the heart. This is also referred to as endocarditis. Again, this is a rare complication, but when it happens, it can just be devastating, and the complications can last you for the rest of your life. And again, it is totally preventable with antibiotics. So if your sore throat is due to a virus, you do not need to be treated with antibiotics, and you don't even need to see a doctor. But if it is due to strep throat, then in most cases you probably should be treated with antibiotics. And remember, those antibiotics will make you better faster, they will make you not contagious faster, and they will prevent all those complications that we talked about. And strep throat makes up about 10% of all sore throats. So how do you know if you have strep throat or not? Well, the short answer is that your primary care doctor can swab your throat and do a rapid strep screening test. And if that test is positive, then you likely have strep throat, and they'll probably send you home with a prescription for antibiotics. But if it is negative, you don't need antibiotics. However, in addition to that rapid screening test, your doctor will also do a culture for Streptococcus, and that usually takes a few days. So it could totally happen that you go and see your doctor, you get your throat swabbed, the test is negative, your doctor sends you home, and then a few days later, he or she calls you back and they say, well, actually it turns out you do have strep throat after all, and they give you a prescription for antibiotics. Now, if that happens to you, don't worry. It doesn't mean that you have a bad doctor and they screwed up the first time and now they're just covering their tracks. It means that they're a good doctor and they're actually practicing good medicine. That's the way you should do it. And remember, those antibiotics will still help you even though it's a few days further down the road. But let's say that you call your doctor's office and they say, yes, absolutely, we would be just thrilled to fit you in on July 7th, 2034. Because let's be honest, that totally happens all the time, right? Well, you could always go to an urgent care center or something like that. That would work just as well. But let's say that for whatever reason, you really don't want to, or you can't see your doctor? Is there some way that you can know ahead of time whether or not you need to go see your doctor? The answer to that question is yes, thankfully. You can narrow things down and know whether or not you need to go in and see your doctor by knowing the following information. First of all, strep is much more common in younger people. In infants, it's very, very rare. It doesn't happen hardly at all. But by about the age of 3 or so, strep throat becomes very common, and it remains common throughout childhood and adolescence and into the teenage years. As an adult, strep becomes less common, but it can still happen. Another thing is that patients with strep throat do not usually have a cough or a runny nose or conjunctivitis, basically pink eye. But they do have those tender, lumpy, bumpy lymph nodes in their neck that we talked about before, and they will often have very inflamed tonsils and often will have what we refer to as exudates on their tonsils or in the back of their throat. Exudates is basically a fancy word for pus, and it looks a little something like this. So, if you or your child have a sore throat, and number one, you're relatively young, you don't have to be young, but it's more common. Number two, if you have a relatively high fever. Number three, if you have those tender, lumpy, bumpy lymph nodes that we talked about in your neck. Number four, if someone looks in the back of your throat and they say, wow, those tonsils are pretty big and inflamed, and you have those white or yellowish patches in the back of your throat or your tonsils, those exudates that we talked about. And number five, if you do not have a cough or runny nose or conjunctivitis, basically pink eye, then there's a pretty decent chance that you have strep throat, and you should go see your doctor. Number one, so that they can make sure of the diagnosis, but more importantly, so that you can get a prescription for antibiotics. But if you don't have any of those 5 things, then odds are you don't have strep throat. You probably have a virus causing your sore throat. And in that case, you don't have to see your doctor at all, and you don't need antibiotics. So in that case, why bother going and sitting for an hour in the waiting room, and then sitting for a half an hour in the exam room, and then getting your throat swabbed, all so that you can pay a copay and be told that you don't have strep throat? Who needs that? But when in doubt, or if you find yourself somewhere in between, let's say you don't have all 5 of those things, but maybe you have 1 or 2 of them, what should you do then? Well, base it on how you feel. If you don't really feel all that sick and you're in between there, then you could give it a couple of days. That actually wouldn't be crazy at all. You could give it a couple of days, and if you don't feel all that terribly sick and you get better over the next couple of days, you're good, you're done. But if you don't feel all that terribly ill and you fall in between, and you give it a couple of days and you actually start feeling worse, then you should probably go see your doctor. All right, guys, that's it for now. If you have any comments or questions, please leave them in the comments below and I'll try to get to them. And if you like this video or you found it helpful in any way, please hit the like button or subscribe or share with your friends. I would really appreciate it. But in the meantime, stay safe out there, stay sane out there, and remember, every day, try to find a way to make the world a better place. I'll see you soon.